Welcome to the Mindbeat podcast by Effective School Solutions. I'm your host, Duncan Young, CEO of Effective School Solutions.
And I'm your co-host, Laine Whitaker, Senior Director of Professional Learning at Effective School Solutions.
The Mindbeat podcast is the definitive source for all topics related to school-based mental health, from sharing best practices to highlighting innovative school districts to keeping track of legislation. Mindbeat is the go-to source for educators and administrators looking to implement a mental health care continuum. Together, we can make a difference in school-based mental health care and in the lives of students, families, and educators. Let's get started. Hello, everybody. My name is Duncan Young. I am the CEO of Effective School Solutions.
And I'm Laine Whitaker, Senior Director of Professional Learning at Effective School Solutions.
We are your hosts of the Mindbeat podcast. We're incredibly excited to be with you here today for our launch episode of the podcast. We're going to be joined very shortly by our very special guest, Amy Kennedy, who is the co-founder and the education director of the Kennedy Forum. We are incredibly excited to be with you today. We've got a great show for you. Laine, how you doing?
I'm doing really well. How about you, Duncan?
Good. You've been traveling a lot lately.
I have. I've been on the road. I was visiting some of our districts in Southern California and then in Northern California, and it was a wonderful visit. I really enjoyed being with, boots on the ground with our district, seeing the teachers, seeing the kids, seeing how our coaches are interacting, and how much the teachers are loving getting trained and getting the support that they need. So it was phenomenal.
That's great. And have you stayed healthy? Do you find that travel is kind of like you're getting colds and whatnot? I should not be asking you this now that you and I are like 3 feet away from each other right now.
Well, time will tell.
Yeah,
time will tell.
Please
check back with me in a couple of days, and I'll let you know.
Tell me you're healthy. Right? So.
What's the what is it called? The incubation period? I don't know. We'll check back in.
Hopefully that incubation period doesn't expire during the middle of our podcast today. Okay.
Excuse me.
Got it. I think it's I think as COVID is obviously still with us. It seems to be receding, but I think we're all realizing that we had 2 years where no one actually got sick with anything other than COVID, and I think that's all coming back right now. So I'm hearing about flu. I'm hearing about Flovid, which is like the combination of flu and COVID, which just
that's our made-up word for the episode now.
Which sounds like the worst thing ever, right? Like terrible. So,
that does sound. No, I've heard that too. That's on a rampage. The flu, cold season, everything. It sounds like it's all ramping up. We're not masked up, although I proudly wore my mask on the plane. It was close quarters. A lot of people are traveling internationally. So I did do that. I did take care of that part.
I hear mixed things about whether or not that little stream of air that comes out of the top of the airplane ceiling actually creates a protective germ cocoon around you. I don't know if that's true.
I've never heard that, a germ cocoon. Yeah. I was not aware of that, but I did read an article during the pandemic, the heart of it when I was traveling still, that apparently they cycle through fresh air every so often. I don't know what the frequency is, but enough that it should prevent you from having germs circulating the plane. We'll see.
I think it's true. I think it's planes and casinos do the same thing. They're just pumping pure oxygen, so that you can stay awake and you want to gamble more.
Yeah.
I
don't know. I'm not really, I believe I've never been to Vegas. I avoid the casinos in Atlantic City.
That's not a bad thing. So.
I've never had any desire to go.
Got it.
But I've heard that. I've heard they pump it through with oxygen to keep people happy and gambling. And I heard it's actually scented as well, like pleasant odors.
Got it.
But I wouldn't know.
Okay, well, shifting hard transition from pleasant odors to the agenda, the great agenda that we have set up for today. We're going to be hearing very shortly from Amy Kennedy, who is the co-founder and the education director of the Kennedy Forum. We're incredibly excited to have her with us today. As we do at the top of every episode, we're going to start with our 2 standard segments. Our first segment is our top 3 for today. So as we do every episode, we're going to get started with our top 3, where Laine and I will share 3 big ideas in response to a key mental health question. And these questions are usually things that we are hearing every week from district partners. I'll actually take this one. Laine, I think you're going to take some of our top 3 in our future episodes. But one of the things that we have been hearing a lot about from our district partners is how do we sustainably fund our mental health initiatives, and what does that look like? So the top 3 for today is top 3 ways to fund school-based mental health initiatives over the long term. And there are way more than 3 ways to do this. We actually have a brand new funding guide that is about to be launched on our website. for anyone who would like to take a look at that, www.effectiveschoolsolutions.com. But the three things I really want to highlight, first is our traditional federal funding sources. So traditional federal funding sources like Title 1A, which is supplemental federal education funding that is distributed to districts based on the number of students in poverty, as measured by the percentage of students on free and reduced lunch. Title 1A is a great source that can be used for mental health support in schools. And I would say the majority of districts, particularly in areas that do have higher levels of poverty that work with ESS, are using Title 1A to fund their mental health initiatives. Also, IDEA, as some individuals call it. This is the Individuals with Disabilities in Education Act. This is special funding for students who are classified as special education with a disability that impedes their ability to interact with their learning. And many students, not all students, but many students who do have mental health challenges in the school setting are classified as special education, and IDEA funding can be used, of course, for those students. A second one, in addition to, so the first one is those traditional federal funding sources of Title and IDEA. A second one that I'd highlight is Medicaid. Right now, all states have policies where students who do have IEPs, who are classified as special education, districts can submit for at least partial reimbursement of the cost of mental health services delivered to those students. In addition, 20 states have actually expanded that policy to cover students who are in the general education, the non-special education population as well. So I think we're going to be hearing a lot more about Medicaid in the coming years and months. The federal government has recently introduced a whole new set of policies around the creation of a technical support center and kind of redoing a lot of their policies and regulations, because right now it's really hard for districts to access Medicaid. You actually need, kind of reimbursement systems. It's a very complicated kind of reimbursement protocol, and I think the federal government is working to make that easier. So we should all keep an eye on that. The final thing I'd want to highlight is the Bipartisan Safer Communities Act. This was also called the BSCA. This is the law that the federal government passed over the summer around gun safety that was passed in the wake of the tragedy in Uvalde, Texas, with the school shooting there. And we don't have time to get into everything that the BSCA has, but it's got a lot of funding both for physical hardening of school environments, but it also has a significant amount of funding for mental health supports for students. A lot of that is going to be coming out under the umbrella of Title IV. So Title IV is an existing kind of federal funding source, but I believe the exact numbers are about $1 billion in additional Title IV spending that's going to be added to districts via the BSCA law. And I think this is not really on the radar screen of a lot of school districts yet, but in the coming months, I am assuming guidance will be coming out for the federal government about how that new allocation will make its way to school districts. So traditional federal funding sources, Medicaid, BSCA, those would be the three main funding sources that I'd want to highlight in response to that question of top 3 ways to fund school-based mental health initiatives. Anything you want to add to that, Laine? I'm
just really excited to hear that there's all these things happening to fund it and that the government is taking it really seriously. So I'm really happy to hear that. Yeah, the big thing districts are focused on right now, with the ESSER funding, the COVID relief funding that was made available to schools, that can obviously be used for mental health services. There were 3 kind of tranches or kind of layers to that. They expire at different times. The biggest tranche, ESSER 3 or the American Rescue Plan, I believe the funds there must be either encumbered or spent by September 30th, 2024. So what is that? A little less than 2 years from now. Mm-hmm. But we all need to start planning for the post-ESSER environment, because a lot of districts have used ESSER funding to, for the first time, really innovate kind of around mental health. A lot of these kind of deferred investments that they've wanted to make for a long time, they finally had the funding to be able to do that. So I think as a broader school community, kind of external organizations, school districts, we're all going to have to work together to really figure out the best way to make sure that we sustainably fund this. Because I think, as we all know, student mental health challenges are not going to follow funding cycles. And I very much believe, and I think the educators that we work with are also believing that this is a long-term challenge that districts are going to be facing. For sure. Yeah. For sure.
Okay, let's move on to our next segment in the news, where every week we want to highlight a couple of school-based mental health related news articles that have really kind of caught our attention. We've got a couple here, Laine, that we want to cover this week. You want to take our first one, and this is an Education Week article entitled "Pandemic Anxiety Was Higher for Teachers Than for Healthcare Workers." What did you find out in this article?
I was surprised to hear the superlative that it was higher for healthcare workers. That was surprising. However, I had no doubt that it was extremely stressful. It continues to be stressful for teachers. Myself going in to do observations and seeing teacher interactions, both virtually and in person, it was a real struggle and a challenge for teachers to convert their whole teaching or modify their whole teaching strategies to online. And then what was super impressive is that a lot of times you had both. You had students online and in person, and had to make sure that you were engaging both audiences, that you're responding to questions online while still making sure everyone's on task in person. It was very stressful. On top of that, you've got the masks, the COVID protocols, teacher shortages. There was just a lot of stressful things going on. So I'm not surprised to hear that, but I was slightly a little bit surprised that it was more so for teachers than healthcare workers.
Great. And as with all of the articles we feature in the news, these are going to be up on our Effective School Solutions social media feeds. So Facebook, Twitter, if Twitter actually still exists at the time that all of you are kind of listening to this. I think that kind of remains to be seen. LinkedIn, and you can also find these articles on our website. So the second article that really kind of caught my attention that I want to highlight is from the Columbia University Department of Psychiatry. And this is entitled "How Sleep Deprivation Impacts Mental Health." Really great article. Couple of key takeaways, and some of these are going to be very obvious, but I think they're very timely given some of the challenges that are going on with our young people. So, I mean, some of the key points in the article: number one, sleep is incredibly important to our mental health, and that there are real psychological effects of sleep deprivation. So there's some studies cited in this article that really show that otherwise healthy people can experience increased anxiety and distress levels following poor sleep. And I think we all see that on our day-to-day, lives, right? Same with hunger. We might be kind of, if we're hungry, we get hangry, right? If we're sleepy, we get slangry. I don't know if that's an actual kind of
getting really good at making up these words.
Yeah,
I love it.
Yeah, I can see my 14-year-old kind of listening to this and just rolling her eyes at what very much was a dad joke. Let's be kind of honest with ourselves here. So, but to me, the biggest piece on this was the third main bullet point, that the COVID-19 pandemic created a host of new challenges to sound sleep. There's actually speaking of new terms that we're coining, there's a term here called coronasomnia that really talks about how insomnia levels increased significantly during the COVID-19 pandemic. And I think we heard anecdotally through a lot of the districts that we work with about students whose sleep patterns kind of fundamentally changed during COVID. They became night owls. They didn't really have the regular structures of in-person schooling, so they're going to bed at 3 a.m. and they're waking up at 10 a.m. And that has a lot of predictable challenges, I think, with the ability of a student to self-regulate, the ability of a student to kind of manage their own emotions. And I also think it's really important to note that this is not just a COVID thing. There have been plenty of studies that have shown that since like the rise of pervasiveness of one-to-one devices and social media kind of in particular, starting about 2011, the amounts of sleep that young people are getting has been, decreasing dramatically. And I think that's one of the main hypotheses about what might be driving the big challenges that we've seen with the sharp uptick in mental health challenges over the last 10 to 15 years, particularly, the most severe mental health challenges, severe anxiety, depression, suicidality, kind of, et cetera. So something that we really need to keep an eye on. I know that a lot of school districts from a policy standpoint have this very much on their radar screen. I know in our local district here, the start time for school has been kind of moved back in recent years. I know down in Montgomery County, Maryland, they were one of the first districts, I think, kind of nationwide to really look at the school calendar and to bump kind of start times for students back about an hour. So this, I think, is going to be an important policy piece. And it's, not just about students getting enough sleep. It's also about kind of their mental health and wellness.
For sure. I mean, it makes sense to me. If you're in your stress response, you're producing, heavy amounts of cortisol and adrenaline, which we know can cause all kinds of hormonal changes, including insomnia. Then you're up in the middle of the night, don't know what to do with yourself. Let me play this video game, get some dopamine in there, and, the cycle continues. So that's not surprising. It's unfortunate, but not surprising.
Agree.
Yeah.
So Laine, I think we should introduce our guest for today.
Yeah, I'm excited. It's a woman after my own heart, a former educator who is, a champion for mental health causes. So
100%. So we are incredibly excited to welcome Amy Kennedy, the co-founder and education director for the Kennedy Forum. I have a bio with Amy that I'm gonna kind of keep this kind of very concise because I want to maximize our time with her. But, Amy is a former educator, started as a New Jersey public school teacher. She is a mother of 5, and she's one of our nation's strongest advocates for youth mental health. Her specialty is really in pursuing partnerships and collaborations that emphasize social emotional learning, trauma-informed care, social media safeguards, school-based treatment options, screening, and much, much more. She co-founded the Kennedy Forum, one of the nation's leading mental health not-for-profits and advocacy organizations, with her husband, former Congressman Patrick Kennedy. That they founded the Kennedy Forum in 2013. And I can't think of an individual that we know who is more passionate about mental health causes. Amy is also a board member for Effective School Solutions. We're incredibly fortunate to be affiliated with her and to be able to benefit from her guidance and wisdom. So Amy, welcome to the MindBeat podcast.
Hey, thank you so much, Duncan and Laine. Good to be with you.
Now we're excited to have you here. So maybe we could start off, Amy, just kind of going back to the beginning, right? Maybe you could talk to us a little bit just about your background, particularly as it relates to both education and to mental health.
Sure. I spent about 15 years working in public schools. Both my parents were public school educators. And in that training for preparing for my career, I didn't learn anything really about mental health. I had learned some child psychology and brain development at Penn State, where I went to school, and I really loved those courses. But a lot of my focus in training was on preparing my lessons. And then you get thrown into your first classroom and you realize a lot of what you're there to do is to help manage behaviors and to be a support and develop connections with your students. And that was not something that I had really been prepared for. It's the part of being an educator that really matters. And we're hopeful that we'll see more of a demand in the field for that kind of training. But over the time in the classroom, I felt very frustrated by not being able to provide some of the services for the students in my classroom that I know needed them. You have maybe a guidance counselor in your district that you could send students who you thought were having a hard time to the guidance counselor. But it really wasn't enough. It wasn't going to be transformative and meet all the demands that you were seeing. And so after meeting my husband, Patrick, who had focused a lot of his efforts around insurance coverage for mental health conditions, I began to think more about what schools could be doing and how we could be focused a little bit more on the prevention and early intervention.
Got it. So when it's striking to me, Amy, that you're kind of maybe individual journey as an educator of wanting to kind of achieve kind of like a higher knowledge level about mental health of the students that you were serving. I think there's almost a parallel in maybe the way that districts are starting to build their own collective systems level competency kind of around this. So, I mean, when you think about kind of framing it in that way, like what's your assessment of the state of school-based mental health today, kind of nationwide? And this is obviously going to vary region by region, but what do you think is working well, and what do you think some of the big areas for improvement are?
Oh, I think there's just so much work still to be done. If we were to make that comparison of kind of my own realization of how much I needed to learn, this is still in the really formative years. I'm still a student teacher in this analogy. And that's where I think school districts really are still at. They recognize the correlation. They know that for student success, that they're going to have to address school-based mental health. They're going to have to address the needs of their students, and that it's not going away. But they're still looking for kind of the plumbing. How do they set up the system within their school, within the community, to be able to move students through regardless of where they enter, at what point they are in their mental health journey? Is it a prevention pipeline? Is it somewhere in between? And how do we make sure that the handoff is seamless through schools to the community, to the family? And we're excited kind of to see the interest level, but know that with that interest level, there's going to be a lot of missteps, and really focusing on evidence-based, on very clear data and reporting of outcomes will help us get the results that we need so that the investment will continue.
Amy, I can relate to so much of what you said earlier about, I was a former educator as well, and I did not feel prepared to meet the needs of my students' emotional needs when I entered the classroom. So I'm wondering, once you recognized that that was going to be paramount for you to be an effective teacher, how did you learn to meet the emotional needs or the mental health needs of your students?
I don't know that I did, Laine. Unfortunately, I think a lot of the realizations that I had came later. There are many students and many regrets that I have about not being able to do more for those kids. As a person who is no longer in the classroom, but very focused on this, I saw the gaps in what I was able to provide and what we could do, what the potential is for our young people. But, a lot of it came around even just a shift in mindset, which I was able to make that shift in how I saw mental health and the challenges, the behaviors that I saw in my classroom, and a different thinking around discipline was kind of where I started to make those shifts in seeing this as skills that were needed for young people and not something that they were doing that was bad, right? So being able to see challenges to flexibility and challenges to frustration tolerance that students had, being able to make good decisions and learning those skills versus, just defiant behavior or something that was a discipline referral, which I would have thought at the beginning of my career.
Mm-hmm. Yeah, I agree, because I'm constantly referring to the Maslow's hierarchy of needs, and that usually these behaviors are a result of unmet needs. Usually the Maslow's hierarchy of needs says that education is going to be the last priority until those essential basic needs are met. So I can certainly appreciate that. Mm-hmm.
Amy, what are some of the state, I think, of mental health has obviously been in great transition, particularly kind of with the pandemic the last few years. I think we all know that we were, really in kind of a crisis state even pre-COVID-19. But what have you observed and what have you seen over, say, the last 5 years, inclusive of that time with the pandemic, both in terms of the intensity of challenges with students, but also maybe the way that school districts have responded, either with respect to how they perceive their role or specific kind of strategies that they're putting in place to address kind of student mental health?
Yeah, I think we really started to see a rise around 2009, between 2009, 2011. And within the last 5 years, taking a look at how we could begin to address it. So more adoption by schools of the social emotional learning, prevention pieces, bullying practices, anti-bullying systems, life skills, going back to character education, and only in probably the post-pandemic, more of a deepening of what we could do for students who were maybe at a tier 2 or a tier 3 level, so that we could address some of their needs and make sure that we were bringing in families as well to be part of that. And the shift has been significant in the way we think about mental health. For the first time, we're really seeing leaders and experts that are calling on this, whether it's the Children's Hospital Association saying that we have a national emergency, or the pediatricians that weighed in and said, we have a national emergency. We're seeing the political will to fund these efforts. And that's when you know there's more here that has to be done. When we're willing to start to bring this to the national stage and federal dollars are being allocated, then it is top of mind. It is dinner table conversation for every family. And we are at a point in our kind of public education system where if we're looking at how we're going to meet the need, we have to figure out how to address the, capacity building that has to happen, because the demand is so high and it's very difficult in more rural areas for families on their own to find the kind of help that their young person in their life might need. So how do we build that capacity? How could we do it through schools? And I think there's a lot of agreement that, a no wrong door policy is going to be our best method for meeting the demand, with a focus on prevention and early intervention, but building out the pieces for students who are struggling. And without addressing the burnout of staff and teachers and mental health professionals, we won't be able to really meet this head on.
Okay. So Amy, put on your policymaker hat for a second. Two-part question. Do you think federal and state governments are doing enough right now? Do you think they're paying enough attention to the challenge of youth mental health? And are there a couple of things that if you had, a governor in front of you kind of right now and you were advising them on, what are the top one or two things that you would advise them to be doing from a policy standpoint?
Oh, there's so much that still could be done. So are we doing enough? I think the attention's there, but I don't think we could possibly be doing enough. The Surgeon General just said this is the number one health concern in the United States. So until we're addressing it with that level of urgency, we are not doing enough. If I had the attention of the governors in the state, I would say to those states that had not yet done a Medicaid state plan amendment to expand Medicaid for those students who do not have an IEP to cover mental health, that would be first step. Tap into those federal dollars, make sure that we're doing what we can at the state level to help fund the need that's coming down the pipeline, and knowing that CMS is anxious for us to do that. So that's an easy first step. The language has already been done. Model language from many of the states, as you mentioned, Duncan, in your opening, is already set. So states can take this on today. I would also think through with states how they might shift some of their funding to be able to allow districts to implement things that are going to work for their school district while setting up a state technical support, so that when it comes to having resources available, trainings available, they can do that. But then knowing that the schools are going to need some boots on the ground, some help right in their classrooms and districts to move this forward. Sustainable funding is going to be top of mind for every district that's thinking of making this investment.
So let's talk about funding a bit. You just mentioned kind of Medicaid. Clearly, kind of that's a opportunity and a lever for states and districts. Anything else you'd want to point out from a funding standpoint about like achieving sustainability and where you think we need to be going here in the next kind of year or two?
Yeah. It's it's going to be really important that we move past just the Project Aware grants, and how do we make this something that's permanent, something that's an essential foundational piece of education. And until we can do that in a way that schools can rely on, they can't build this out. We won't see the workforce build out that we need, because we aren't going to have the funding to pay those professionals in a way that makes sense. So reimbursement rates will be important. We also know that, in states where they've made this a priority, they've really focused on the serious mental illness. For example, I got to sit down with Mayor Darrell Steinberg just yesterday in Washington. He is the author of Prop 63 out in California, and that's the millionaire's tax, for those of you who are unfamiliar with that, where they set aside money specifically for mental health. And when they originally set that up, he talked about how they set it up in an 80-20 kind of breakdown, 80% for more serious mental illness, 20% for prevention. And knowing that for it truly to be successful, eventually they need to have it in the reverse, right? We have to be spending 80% of our dollars on prevention because we can never scale up enough.
Sure.
Otherwise.
Yeah, you're on a treadmill that you're never going to win that race. So you almost need to transition from 80-20 and then have like some type of scale where it like transitions year by year over time.
Amy, I'm wondering what you think is the most misunderstood thing about mental health. And if you had the power to change anything about school-based mental health, what would it be?
I think it would be the perception of it as a weakness. Or that it would be political. I think the military in many ways has been able to focus on this over recent years. You know, my husband Patrick tells the story of visiting the Green Berets at Fort Bragg, and the general there talked to him about the amount of investment that they make in the Green Berets and how mental health is mostly a priority for their top performers like the Green Berets, because they see it as a force multiplier. And that perspective of mental health as being something that we all should be investing in because it will lead to better outcomes, more successes, instead of a weakness or a gap that we have, is really a cultural shift that I think needs to happen. And when we do that, and we all believe we want the best for our kids, then we would never do without this piece.
For sure. Thank you.
Amy, what would you say is in your personal mental health toolkit? So when you think about just kind of how you go about your kind of, day-to-day life, is there anything you'd want to share with the audience here about like the tools in your toolkit for how you kind of maintain your kind of own personal mental health?
Yeah, you covered it actually at the beginning when you talked about sleep. It's so simple, but it's so crucial. When we look at our own 5 kids, if my 4-year-old is whiny and crying and he needs a nap. But it's still true for adults. It's true for, all ages. It's so clear when you need sleep. And the other thing that I've just been focusing on this week, if you haven't listened to another great podcast, Hidden Brain, they talked about weak ties and the relationships that we have that maybe aren't our closest friends and family, but the happiness that we get out of conversations with people that we run into frequently. So, whether it's talking to the person that delivers the mail or the bus driver, the person at dry cleaning that's checking you out, that those actually increase your happiness. And so I've been thinking about that this week and just making sure that I'm really focused and engaged when I'm running into people and making those conversations.
Absolutely. I actually had a conversation with one of my best friends a couple months ago, and I was a little irritated that I felt like she hadn't been there for me in the way that I needed. And when her response was, "Laine, wow, I'm really sorry. Do you know who else is going through something?" I said, "Who?" And she said, "Literally everyone." I was like, well, I guess that's true. And so it really, after I had a little laugh like that too, it made me realize just walking around in public that everyone is going through something, to be really sensitive to that, especially now in these times. And just to realize everyone's got their own stuff happening, and let's be nice, let's be kind, let's be gentle with one another. So I can appreciate that for sure, paying it forward.
Yeah, I think that's a huge thing. I'm hopeful that we are kind of moving into just a good era of civility in our society. That's what I think we should all be kind of, aspiring towards. Let's be good to each other. Let's be kind to each other. I think, it starts with those individual, one-on-one interactions each and every day, and then hopefully kind of multiplies from there. But Amy, any parting thoughts you want to share with us and the MindBeat audience?
I think it's really just about figuring out what works for your local area. And sometimes that's just the language that we're using and making sure that it fits. There's a lot of polling, I think, happening now around how to frame mental health for your specific communities. And it's a topic that we can all relate to. So just think about the framing to get it done in your own area.
Sure.
Amy, really appreciate your time.
Yes,
always
you.
Incredibly informative to talk to you. I hope you have a great rest of the day, great weekend. I'm sure you get a ton of kid activities going on, a very full schedule taking place this weekend, right?
Absolutely. Birthday this weekend.
There you
So
go. Yeah.
Happy.
yes.
Yeah, you got the birthday circuit when you got the young kids where it's like every single week
Every-
someone else is having a birthday.
Yep. I remember those days.
Absolutely.
Yeah.
A lot of pizza and cake. Take care.
Awesome.
Thank you
Thanks,
so much, Amy.
Appreciate it. Okay, so we're going to wrap up with our final segment today of what inspired us this week. Laine, do you want to go ahead and kick us off here?
Yeah. So, we talked about that article a little bit earlier from Education Week about, the teachers being really stressed out in schools. And I was inspired when I was on my California trip that one of our Northern California districts has really made an effort to support the mental health of their teachers by providing a third party who is always available to them to discuss, to process, all of the challenges that teachers are going through. And as a former teacher, oh man, that would have been amazing because there's a lot of behaviors. There's a lot of really intense, challenging behaviors. A lot of times teachers don't get a break from these kids, especially right now with a lot of teacher shortages. There's less breaks. There's less prep time. You may be with the kids a lot longer during the day. So there's a greater need to process and to, work through challenges. So I was so impressed and happy to see that major support was there for teachers. That definitely inspired me this week.
That's great. Yeah. So what has inspired me this week is really just this is the time of the year where at Effective School Solutions, we're doing a lot of reporting of data back out to our district partners on, the impact of the mental health services that we're delivering to students within school districts. And so I've really been inspired in the last week with a couple of the district conversations that I've been a part of where, you're able to look at not just kind of the quantitative data about how students are progressing kind of in services. Are they receiving the right number of services? Are they engaged at a high level? But I always really enjoy the, kind of student anecdotes to really get a glimpse as to the life-changing impact that really high-quality mental health can have on students in a school setting. So there's not one specific thing that I'll point to, but just in general, being part of those conversations like fills my cup, and I get off of those meetings or those Zoom calls, and I'm always just feeling very, very kind of pumped up about the opportunity for us as a collective society to get in there and make a difference and an impact with students who kind of have that highest level of need.
For sure. When I left the classroom, I was really, oh, my kids really need me. But the benefit of coming to an organization like this was the greater impact that we get to affect so many more teachers who then affect their kids and students. So I love that.
You got it. Got it. Laine, so have a great weekend.
You do the same.
I hope that incubation period does not kind of kick in at some point kind of over the weekend. But
let's hope. Let's hope. I got a lot of things to do this week.
You got it.
I don't have time to be sick.
You got it. Thanks, everybody, for joining the MindBeat podcast. And we'll talk to you on our next episode. Thanks.
Bye, everyone. The MindBeat podcast is a production of Effective School Solutions. MindBeat represents the opinions of Duncan Young, Laine Whitaker, and their guests on the show. The content here should not be taken as medical advice. The content here is for informational purposes only. Please consult your healthcare professional for any medical questions. This podcast should not be used in any legal capacity whatsoever, including but not limited to establishing a standard of care, in a legal sense or as a basis for expert witness testimony. No guarantee is given regarding the accuracy of any statements or opinions made on this podcast. If you or someone you know is experiencing a mental health crisis, please call the 988 Suicide and Crisis Lifeline, the SAMHSA National Helpline at 1-800-662-HELP, or your local healthcare provider.